Hello guys, my name is Dr. Jessica Henry and I'm just here to remind you guys that not everybody needs a tennis elbow release. I am a certified hand therapist, orthopedic manual therapist for the upper extremity and neuro specialist, and also the owner of Hands-On Neuro Rehab. I am on YouTube doing hand therapy tools, just trying to help everyone give or get a little bit closer to their therapy goals so they can get back to what they love doing. Or if you guys are new OTs or PTs and need a little bit of guidance with some of your patients, and I hope some of this information is super helpful as well. Today, I'm just going to give you a little tidbit on tennis elbow because I see a lot of misinformation out there and I see a lot of misguided people. So tennis elbow is a very, very broad term for inflammation of your extensor tendon, your wrist extensor tendon. People use this very broadly when sometimes it can be a very acute injury like an itis or something that like we call like a tendinosis, or if you're looking for the whole entire term like lateral epicondylgia. But most importantly, all that to say is it's just very painful at this tennis elbow region or this ERCB or extensor tendon region. So whenever you have a little bit of pain there, oftentimes people can ignore it and it can grow to be something that is a lot more painful, and it doesn't need to be that. So a lot of the times activity modification is crucial in trying to rehab tennis elbow, like taking your groceries in a paper bag instead of a plastic bag so you're not stressing out that tendon, making sure that you're switching to a book bag instead of a purse so you don't have to go ahead and grab or hold it on that dominant right side, and just maybe even switching your Yeti cup to something a little bit lighter so like you're not continuously stressing out that tendon, or using compensatory techniques like using that other arm to kind of give that bad arm a break. Today, I just wanted to show you one of my favorite exercises. This is commonly done online, but is done online incorrectly. So with a Tyler twist with a flex bar, you are supposed to be eccentrically loading your tendon. All that to say is that it's very slow and it should be heavy. I'll say it again for the people in the back. It should be slow and heavy. So I don't want this over and over and over, this over and over and over in the clinic. And I often have to correct people and give them like a little bit of feedback about like, hey, we want to strengthen the tendon in a lengthened state so we don't have that ripping whenever we go to straighten our arm, bend it back, or whenever we go to grab our Yeti. So what that looks like is you're going to start with the elbows bent, and you are going to first take the bad arm, you're going to put him on top. And what I want you to do is you're going to wind him back towards you. You're going to turn him back over and you're going to let him ride forward very slowly. I want a 5 to 8 Mississippi ride all the way forward. We're going to do that again. We're going to grab him upside down, turn him, bring him back. Slowly let him ride forward. Slowly let him ride forward. Slowly let him ride forward. This hand never moved. It's not this, like we're not doing a winding kind of motion. So what we're doing is, once again, strengthening that tendon and that lengthened state. And that is supposed to stimulate some of that fibroblast activity so the collagen can kind of lay down and heal that tendon, and we can kind of move past this. Remember that tennis elbow is a very, very slow thing to heal, so be very patient with this process. This has been Dr. Jessica Henry. If you guys are interested, you can find more information at handsonneurorehab.com. And we have more information within our hand therapy toolkit where you'll get guided help from me. And you'll also get some of my favorite tools like this flex bar, in addition to our counterforce brace and those other special tools that I utilize in the clinic to help patients get to where they need to be. Thank you guys so much for joining me. I hope you guys enjoy your day. Thank you.